Are you trying to figure out how to best use your bioidentical hormones? You've picked it up at the pharmacy, but you have no idea where to apply your patch, the testosterone cream, and even better yet, when to use your progesterone tablet. Well, I'm glad you asked. We're going to talk today about best practices around using your hormone replacement therapy. Let's get started. Health champions, before we get started talking about the best practices around using your hormone replacement therapy, which is bioidentical, all that just means is that that's natural physiologically as what you naturally make. I want you, if you haven't watched the series on midlife, transition, navigating, what perimenopause, menopause is, please watch that first, because it's packed with lots of great information that would give you an idea of what we're talking about now. All right. So to get started, the three big hormones I'm going to be talking about is estradiol, which is the powerhouse. Not only does it take care of reproduction, it also takes care of the brain, the heart, the bones. So many areas of our lives are dependent on the estrogen. We have about 450 estrogen receptors. So it's important, depending on what stage you are, if you're going through the roller coaster stage of estrogen, going up and down to stabilize it based on the symptoms that you're experiencing. It'll be important to know what that can look like. So it can look like transdermal, meaning a patch. It could come in a patch form, a gel, or a cream. So this is what the patch will look like. The different doses, and you definitely need to work with your physician to figure out the best dose for you based on your symptoms, and of course you have to be monitored closely. So this is my patch that I use at the 0.05, and it has significantly helped me with brain fog, which was really the biggest thing that I was experiencing. I did experience muscle issues and joint pain, but all I did was definitely optimize my nutrition, made sure I was stretching more, make sure I was staying hydrated, did a lot of seed cycling to balance the roller coaster of what was going on with my estradiol. But this definitely has helped with brain fog. If you watch the series, you see why estrogen plays a big role in just the way the brain utilizes glucose. All right, so for transdermal, can either be in a patch, it could be in a cream or a gel, okay? And when we talk about creams, this is from a compound. This is just like a dummy. It's nothing is in here, but just to show you how the clicks work. So I'll show you. So you would scroll it around, and that will show you, it will release some. So I'll show you where this can be applied. But the patch itself is applied in the abdomen. I have one right here. Wednesdays, twice a week, Wednesday, Sunday. Some people do it Thursday, Saturday. It doesn't interfere with, any water. It's just great. Just releases estradiol slowly. Some people put it in their buttocks as well. So this is the patch. And of course, there's sprays. It comes in sprays. There's gel. There's several options. So it's not one size fits all. So now there's also the tablet. But again, really trying to figure out what would be the best option for you. So that's for estradiol, which is the powerhouse that takes care of multiple things in the human body. Now, the next thing I want to share with you is the progesterone, which is the supportive hormone that helps with calm and ease and sleep. So that most times is prescribed in a micronized tablet. So this is what it looks like, tiny. And you take this about an hour before bedtime, and it comes in 100 milligrams and 200 at the FDA approved level. But if you are getting it from a compounding, you have to be very careful that if for any reason there's progesterone sensitivity and you wanted to get it reduced dose, then you could get that at a compounding pharmacy, but you have to be very careful which compounding pharmacy you're using because they're not all the same. All right, so that's progesterone. And then the last that I was going to share with you is the testosterone. So the testosterone is a little tricky just because there's no FDA approved testosterone cream for women, not yet. So when I prescribe it, I prescribe the men's version, which is the test gel. This is testosterone gel. It's transdermal as well. There's several other administrative routes for testosterone, but the most common one is the gel. So this is a box of testosterone. It has about 30 tubes in here. Preferably you want to ask for the tubes than the sachets, because the sachets could be a little messy. So, but with the tubes, one tube, even though this is 30, it lasts a male a whole month. But for a female, she's only going to use 1/10 of this each time. So this one tube will last her 7 to 10 days. Okay, so the question now is, if you are using this, that will last you about 3 months, right? If you do the math, you use a pea size or a blurb, so like that. If you can see, just like a blurb, right? Or a pea size now, and you rub this preferably behind the calf area. So you see that? My calf. Let's see if I can rise. So you rub it in the calf. Make sure it's clean. Make sure it dries off. So just a little, you just rub it and you wash your hands. Okay, there are other places, the arm, you can use the arm, the inner thigh, the calf. Now, the reason why people prefer the clicks is because you don't have to touch it. Now, again, remember, this does not have anything. I'm just showing you, demonstrating. So the clicks, you do, this was 2 clicks, and you just do 2 more. And then you would just rub it. Again, the calf area. Just rub it. So your hand doesn't even touch it. But if you do 4, you definitely have more to rub around your calf. So you just rub it. You rub it till it absorbs into your skin. And then you let it dry, and of course you cap it. So that's how that works. So estradiol, testosterone can all be combined in the same compounding cream. So yeah, so that's what we have. Now, questions about side effects. For estradiol, most times is maybe breast tenderness, because again, as it's working on all the different areas in the body, the breast is going to feel it because it has receptors there, but those usually go away with time. Some women will say slight bleeding, doesn't stay long, very, very slight. That's because the uterus is like, oh, okay, what's happening? Are we, do we need to shed our lining? Now, as long as it's not persistent, there's nothing to worry about. I monitor my patients closely, make sure they're doing well, make sure that they're feeling like themselves again. So that's for estradiol. For progesterone, the biggest concern, if at all, is sometimes feeling of bloating, sleeping. I had a patient that she wasn't sleeping well, so we went up from 100 to 2, and even though the anxiety went away, she was sleeping too much. She was just drowsy. She could not stay awake to save her life. So we went down on the dose. There are some people that are sensitive to progesterone, because the base is peanuts. Again, it's as natural as physiologically we make. So those people might need to go to compounding and get a lower dose. So that's for that. Now, in terms of testosterone, really it's just, I gotta be careful. That's why I don't like pellets, by the way. It's not FDA approved, because you're pushing a big chunk of testosterone all at once, and that can cause hair growth, some aggression going on. So those are some of the side effects. But if you use 1/10 of this, as I've explained, and you change the location, you don't just stay in one place, and sometimes hair growth happens, which you can shave, but the benefit of being on it stabilizes your libido for testosterone, your energy level, and of course, muscle preservation. So I hope this was helpful. All right, let me know if you have any questions, but these are the best practices around using the hormone hormone replacement therapy. Again, remember, clean area, let it dry. There are concerns about transference. As long as you let it dry, you're fine. So yeah, I hope that this is helpful. Remember that you deserve to live at your finest because you are worth it. Take care.